to recap, the antigen is the chemical that the foreign bug or protein our body will see. And everybody today with COVID has been thinking mostly about, at least in the beginning, a lot about the B cells and the immunoglobulins, and the T cells now we're realizing are probably giving us very important immune memory that lasts quite a bit. I don't want to change subjects, but you want to say a word about T cell memory? Because I think that's important, especially in regards to what the testing you do and also the COVID issue.
So the broad concept of T cell memory is that once an infection is under control or improves or is cleared, the same antigen, for example, that let's say a week ago was responsible for creating Th1 T cells that fight, but now antigen is very limited, so not as abundance in the lymph node anymore, because let's say the bacterium has died off in the body. And if that antigen now is seen, the information that is conveyed to the T cell switches and educates the T cell to become a memory T cell. And as everything with T cells, there's not only one type of memory T cells, there's multiple ones, and they all have specific roles. Okay. And that are sometimes temporary, sometimes more long-term. And then you can measure in the blood, for example, so-called central memory T cells. They get made usually at the tail end of an infection, and then they circle around the body. And they can be measured in the blood for, depending on the disease and the antigen. That's always a limiting factor you have to keep in mind. For between like 6 to 8 weeks, or for other diseases or antigens, maybe even sometimes up to 6 months, you can see these T cells in the blood. But in context with COVID, people are often talking about and think, or not, I don't know if they talk about it, but they think about what they mean is the tissue resident memory T cell. That is one really hard to find in the blood, because the majority of these T cells are, per definition, or by their name, tissue resident. So you don't find them floating around in the blood. So they sit in the skin or in the lung, and also, again, like the information where to go is given to them the moment they see the antigen, and then they home into the tissue and they stay. So now T cells have a limited lifetime. Also, tissue resident memory T cells. It's not like you have an immortal cell that doesn't exist. So now a disease is cleared and you don't have antigens. So now you can ask the question, how come that against some diseases we have these memory T cells for quite some time, right? The answer to that is there's a system in place for certain tissue resident memory T cells that makes them proliferate, like spawn offspring, if you so will, within the tissue that doesn't require antigen to be present. Because otherwise we wouldn't have long-term immunity, right? Otherwise we have 6 to 8 weeks this sitting there, no new antigen after a disease is gone, no memory, right? So that is a system that is there, and that again depends on what type of disease it is, and how long these T cells can perpetuate that. It's also a limited lifespan or limited amount of proliferations or something like that. So for some diseases, we may have these tissue resident memory T cells for a few months. For another disease, we have it maybe for a couple of years. And for another one, we maybe have them even longer. But for COVID, obviously, as this is still a new disease, I mean, it's around for 2 years now, we don't know that yet. And I think the indication is that they're also not going to stay there forever. So it's not like you had COVID and you have immune memory T cells for the rest of your life. That's a misconception. Like coronaviruses are not known to generate long-term memory effects. And so our test is really good at checking for T cell activity that is currently going on. So we check often for the Th1 T cells and also for the central memory T cells. So with these two subsets, you have a nice system where you can look at a specific disease and you will find the Th1 T cells at the beginning of a disease quite solid, and especially in viral infections, we find a lot of T cells often. And that indicates like a high viral burden or high disease activity. So once the immune system starts controlling the viral replication, as I mentioned, the antigens go down, and then we see usually the central memory T cells come up for a brief period of time. And and if you see these T cells, you can assume that you will also have down the road tissue resident memory T cells as well.
Okay.
Because that's the logic consequence of that. But with an ELISpot, how we do, you can't measure that because again, tissue resident memory T cells are not found in the blood, or if so, only for a brief period of time and very rare. So for that, if you want to check for those or measure those, you would need to go like go classic, like go tuberculosis classic, right? Take the antigen and make a skin prick test and wait 48 hours. If you have then an eczema on that, you know you had memory T cells there.
Right. Okay.
So, right, because they reside in the skin, not in the blood.